Healthcare recognizes the gentlelady from Tennessee's Blackburn. 5 minutes for questions, please.
Thank you, Mr. Chairman, and thank you for being with us today. We appreciate this. Mr. Potter, I want to be sure I understood you right. You said that we were charging people so much for health insurance that they couldn't afford to buy it. Before, you made that as a statement that took place before Obamacare. People were being charged so much that they couldn't afford to buy health insurance. Did I understand you right on that?
You're right.
Okay. Let me ask you this then. I've got some stats from people in my district of how their health insurance premiums have gone up since the passage of Obamacare. And I want to just read through these. I've got a car dealership down in Fayetteville. They dropped coverage because the increase is so much. An insulation company with 36 employees in Nashville, they dropped it due to a multiple-year large rate increase in administrative burdens on their plan. A consulting firm with 2 employees, 56% rate increase in 2013, and that followed a 15% in 2012. A restaurant over in Springfield, employees no longer allowed to work more than 29 hours a week. That's a jobs program for you, isn't it? Okay, an auto parts company over in Laverne, okay, they had a management carve out, but let's see, a 30% increase last year, not going to be able to offer coverage to everyone that works 30 hours or more a week. I mean, the list goes on and on. We've got a flooring company with 30 employees, a 21% increase, and a law firm with 3 employees, a 16% increase this year, 38.5 last year. Physician's office, 7 employees, a 21% increase. A commercial printing company, 25% increase. A manufacturer with 6 employees, a 25% increase. A construction company with 9 employees, 15% increase this year, follow on top of a 42.5% increase last year. Oh, here's a private school with 68 employees, a 17% increase. In a retail flooring store with 5 employees, they had a 123.27% increase that is taking place next month. Sir, what do you tell these employers who are trying to do the right thing? You thought health insurance was expensive before, but what do you tell them now? It's exorbitant?
I might tell them the story of Jim and Leslie Elder, and I don't think it's disingenuous. And we can
No,
look.
we're not going to go there. You've sat there and told that story over and over and over. And I have great
Because
compassion
it's an important story, and I'm from the great
well,
state of
no,
Tennessee.
sir.
My wife,
it is
my
my
mother
time, and we're not going to tell it again. I have great compassion for anyone who loses a parent through such a situation. I have just lost my father. And I understand what people go through. But I've got to tell you something right now. I think that what we have to do is look at what is happening to these insurance costs. And here is one I've got. These are all in my district. These are real live numbers that are coming back in. And I can tell you something right now. Have you ever heard of TennCare?
I have.
Okay, we had that in Tennessee, and you know what happened there, don't you? It was a disaster. It was such a disaster that a Tennessee governor, a Democrat governor, had to go in and completely reshape the program. Let me ask you this. Have you ever heard of is there any public option health care program that you can point me to that actually saved money and increased access?
Public option? We don't have any public options in this country.
Oh, that's not what you call you call TennCare. It was the test case for Hillary Clinton's health care. Well, then let me ask you this about guaranteed issue. Right here, I've got in 93, a 30-year-old woman in New York had an average premium, let's see, of $1,800 a month. And then New York passed guaranteed issue and community rating. And guess what that premium went to? $3,240. So you go from $1,800 to $3,240. That is a $1,400 a year increase after you insert government control. So if we don't have public option, then have you ever seen a government-run healthcare system that has increased outcomes, decreased costs, and increased access?
Many systems around the world have done a much better job of increasing access and controlling cost and having better
My
outcomes.
time is about out. Mr. Holtzaken, any examples you can point to there that have lived up to promises?
There are no U.S. examples of that type, ma'am.
Okay. Mr. Carlson? You have none. I yield back.
Gentlelady's time has expired. The chair recognizes the gentleman from Kentucky.